गुड मॉर्निंग। आप लोगों के साथ थोड़ा सा डिले आ गया बीच में, बट here we go with the diabetes session. The first question is a very typical question and very basic one. What are the causes of type 1 diabetes? Well, as you all know that diabetes can be divided into two types, type 1 and type 2, whereas type 1 is the condition in which there is an insufficiency of insulin. There is no secretion of insulin, or you can say there is an absolute deficiency of insulin. And why is that? Because there are no cells present to produce insulin. So beta cells present on the pancreas, islet of Langerhans, they are no more, and they are destroyed either by immunity and mostly by the immunity, but because of genetic predispositions. Alright, ideally speaking, there should be no difference between both of them, but of course the difference lies in the efficacy, potency and the side effects or ADR profile. And when you compare both of them, oral hypoglycemics are not that much impressive as compared to insulin, because insulin is much more effective in controlling glucose levels as compared to oral hypoglycemics. And also with respect to adverse effects or side effects, I think insulin is still a winner. Why? Because it only causes hypoglycemia, while oral hypoglycemics have so many other side effects like lactic acidosis, like increasing the weight of the patient, which adversely affects the patients of diabetes, and so many other side effects as well. But this side effect of hypoglycemia with insulin is really crucial, and this is far more worse than having hyperglycemia. So we have to create a balance here between these two. The best thing that you can do for that person is to scratch her back and then let her scratch yours. This would be a nice activity to do, by the way. Or you can give her emollients to soothe the skin, some moisturizers to moisten the dry skin, and you can also use anti-allergies if the situation is quite severe. But the more important thing is to understand that why it occurs in diabetes, and this is again because of hyperglycemia that leads to hyperosmolarity of the blood, which in turn leads to dehydration of the tissues including the skin, and when the skin is dry, that causes itchiness. So the best thing other than scratching is to control her blood sugar levels. There is no absolute surgical treatment for diabetes. However, there are certain procedures which can reduce the glucose uptake from the GIT. But again, this is a surgeon's job or a dietitian's, not my field, so I'm not going to comment about it. But one of my friend, Dr. Waqas Elias, is a dietitian currently practicing in UK, may be able to share some good insight into the surgical treatments or even the pharmacotherapies, the new modern insights of diabetes treatment, if he may. Yeah, that's it. That's all about the surgical treatment. This is not because of hyperglycemia or maybe increased sugar levels when you eat chocolate. This is because chocolate has some other ingredients as well. Like for example, it can contain caffeine, it can contain theobromine. Same is present in the coffee or tea. And these drugs actually are CNS stimulants, and they cause an increase in sympathetic tone, leading to increased heart rate. So it's actually the caffeine that causes your heart to race rather than the glucose levels. Glucose does not directly increases the heart rate. It does in the long run, but not any short-term effect. Okay. Well, I guess this is the best thing about diabetes. I mean, it's a disease, but there are certain blessings in disguise, right? There are certain things which are actually good for you. So diabetes, I think, is one of those diseases which actually disciplinize your life, especially with respect to eating habits. So naturally we are accustomed to eat irregularly and eat whatever we want and uncontrollably. But in diabetic population, they can eat anything. So yes, your mother can eat anything. She can eat fruits, she can eat whatever she wants, but only if it is in limit, if her sugar levels are being controlled tightly, then that's everything is fine, no problem at all. There are so many different patients with diabetes who are keeping a very healthy diet and a healthy life. So yeah. Alright, so NPH insulin is a type of insulin which is intermediate acting. So its duration of action is intermediate. Like for example, it covers around 10 to 14 hours in a day. So it can be used as a basal insulin, which means that it will protect you from hyperglycemia, which normally occurs in between the meals, right? So there is a surge in sugar levels whenever you eat, and that can be covered up with an intermediate with some bolus insulin shots like regular insulins or fast acting. But the NPH and glargine and the detamir, these are the insulins which control the basal rate of your glucose levels. Alright, honestly speaking, insulin is the best medicine for controlling blood sugar levels. There is no oral hypoglycemic which has which can be compared to the level of insulin, but only because insulin has a very drastic side effect of causing hypoglycemia, which can be fatal sometimes. So that's why most of the patients are advised to keep some sugar or candies or chocolate bars in their pockets all the time if they're using insulin, because hypoglycemia can be fatal. It is a matter of minutes sometimes. So that is the only drawback with the insulin. However, the other effects in controlling the efficacy of the insulin is not even comparable with any of the oral hypoglycemics, and they have side effects, and they also have decreased efficacy as compared to. Gestational diabetes is an incidental diabetes which occurs during pregnancy, maybe due to hormonal imbalances during the pregnancy. And maybe the reason is the requirement and the increased requirement of glucose by the fetus, so the body become resistant to insulin. So you can go for non-pharmacological treatments of diabetes, hyperglycemia. However, in severe cases you may use insulin, or even metformin can be used. It's safe to give in pregnancy as per the animal studies are concerned. Sometimes sulfonylureas can also be used in combination with metformin, but they are not very much preferred as compared to metformin or insulin. There is no difference between metformin or metformin HCl. It's just the salt in which it is packaged. The pharmaceuticals, they sometimes they use this salt formation with certain acids like HCl regarding so many different drugs. So similarly, metformin is also packaged sometimes in the salt form with HCl, hydrochloric acid. It just increases the stability, the solubility, the dissolution properties, and hence the absorption of the drug becomes efficient, and also the handling, the storage, the stability of the drug, of the active pharmaceutical ingredient become feasible. So otherwise there is no difference in metformin or metformin HCl. So they are the same. So this question requires a proper therapeutics background or skills and knowledge, because this is where you make the decision for your patient. And in clinical, normally decisions are made on these 4 things that I'm going to tell you. The first and most important one remains the scientific evidence. That what kind of evidence are you going to use to choose the medicine treatment for your patient. Second is your patient preference. If your patient is comfortable with the choice of drug, or the dosage form that you have chosen for him. Third is the clinical circumstances, that sometimes the underlying cause, risk factors, diseases must be evaluated, so you may have certain preferred choices. And then last but not the least is the physician's own personal experience. Well, in case specifically for the diabetes, we normally start with the metformin, and that's what guidelines. Fatty liver may not be the direct cause of diabetes, but it may lead to developing diabetes. It is posed as a risk factor of developing diabetes, especially the diabetes type 2. And we all know that the liver is important with respect to maintaining blood glucose levels also, because glucose is produced, is generated in the liver as well. So whenever you're going to have a damaged liver, it may lead to abnormal levels of glucose, which will affect the insulin secretions. Also, there are certain evidences that the inflammation in liver may lead to insulin resistance. So yes, indirectly fatty liver may lead to diabetes, but otherwise fatty liver leads to hepatitis, leading to a liver disease, not diabetes directly. Alright, I have a lot of questions, so I'm just quickly replying to maximum questions I can. And this is a very good question. It's a what is the actual relation of edema and diabetes mellitus? There are multiple pathways which contribute to generalized edema in the patients who have diabetes. For example, in diabetes, in prolonged hyperglycemia, there could be some target organ damages, especially talking about kidney failure, heart failure, and even it can affect the liver as well. So these three organs, whenever they are going to be damaged, you will end up in generalized edema: kidney, heart, liver, right? Then there is another thing, that in hyperglycemia your blood becomes hyperosmolar, and hyperosmolar blood has the tendency to retain fluid, so that leads to fluid overload, causing an increased hydrostatic pressure, causing the leakage of fluid into the tissues. Yeah, that's how it goes. Amyloid protein is actually a byproduct in the beta cells. When the insulin is being produced, these amyloid proteins are also produced, but due to certain genetic predispositions or some other environmental factors, maybe prolonged hyperglycemic conditions, may force these proteins to get deposited in the same beta cells, and this deposition actually hurt them. This deposition of amyloid proteins in the beta cells actually kills them, which leads to decreased beta cells and decreased insulin secretion, leading to an increased risk of hyperglycemia. And this is probably going to be the type 2 diabetes. So in type 1 this is not the case. And somehow amyloid proteins are also linked with insulin resistance. So this can be used as diagnostics, but there are certain other better gold standards like HbA1c present. So this by far is the best question I have received. I think why insulin is given in subcutaneous route and not IV and IM. First of all, it can be given, it's not restricted. You can give in IV or even IM, but the problem is with the abrupt onset of action, because in case of IV you're going to push insulin directly into the blood, which will cause severe hypoglycemia, and that hypoglycemia I've already mentioned, that is very fatal. It may be very dangerous. So in home based applications you must restrain yourself to subcutaneous, which is slow, steady absorption of insulin on a natural pace, and it's safe. So that's why you can reserve these IV or IM for complications like diabetic ketoacidosis or hyperosmolar hyperglycemic syndromes, and in among them IV is the preferred choice, again because it's controllable. You can control the infusion rate. Okay, so the thing about diabetes is that it is not curable, but it is controllable, and it's a progressive disease, which means that when you stop controlling it, it will continue to progress and it will worsen. So, and also it matters that at what point in time were you actually diagnosed from diabetes, right? So if you were diagnosed earlier, that maybe you were pre-diabetic, or maybe you are diabetic with not so severe form of hyperglycemia, In either cases, you can always keep your non-pharmacological treatment as the mainstay of the therapy, which means that you should control your dietary habits, you should go for some exercise and change your lifestyles, and that along with the pharmacotherapy if needed can be used, so it is controlled. So this is the last question, and I truly didn't understand the question properly, but I will try to answer it as much as I can. So sir, why can we not take insulin early in the morning? Heart attack, arrest, explain. So maybe you're referring to a certain case in your surroundings where a person took an insulin early in the morning and ended up in a heart attack. That would probably because of hypoglycemia, because early in the morning you have when you are fasting, of course it's a fasting blood glucose, it's already low, and you're also hypotensive in the early morning. So if you're going to take insulin early in the morning without breakfast, this would end up in severe hypoglycemia, leading to increased sympathetic tone, which causes a stress on your heart, and if you are already an anginal patient, coronary artery disease patient, you will end up in a heart attack. So be vigilant about insulin because it causes hypoglycemia. That's all. Thank you. Alright folks, that's all for today, and see you inshallah next time with a new topic. I will have to see what is the next topic, and this was a very fruitful session, by the way. As always, thank you very much. Until next time, bye.